Okay. So good day, everyone. So for week 6 and 7, our topic would be primary hemostasis. Okay. So for this lesson, I would be your instructor po. Okay. So let's start na po. Okay. So after this lesson, you should be able to summarize and explain the role of the vascular intima and platelets in primary hemostasis. Also to identify the procoagulants and anticoagulant properties that affect the primary hemostasis, explain the procedures, laboratory procedures, and correlates its results sa ating with its clinical significance. So our body, so we produce clot and plugs on the site of injury, and as the wound heals, the clot is dissolved. So this complex physiological process is known as hemostasis. So hemostasis basically is the balance uh, between our balance of our body in producing clot and dissolving them. Okay? So any deviations from the normal hemostatic system can cause hemorrhage or excessive bleeding, or kaya naman ay thrombosis or excessive blood clots naman. So overview of the primary hemostasis. So primary hemostasis refers to the role of blood vessels and platelet in response to a vascular injury or to the desquamation of dying or damaged endothelial cell. Okay, so primary hemostasis, ang involved dito, you have your blood vessels and your platelets. Okay? So take this picture as an example. So in cases of injury, so, injury in our blood vessels. So, ang nangyayari is the blood vessel would constrict. So, nagko-constrict sila, kumikitad yung daanan. So, that will cause our platelets to adhere and to aggregate, which forms our platelet plug. Okay? So, here is our platelet plug. Okay. So, nangyayari is vasoconstriction. So, again, nagko-constrict si blood vessels. Yung platelets, they become activated, they adhere, and then they aggregate. Okay? And then, nagsisecrete din sila ng kanyang nilang contents within their granules. So, yung mga sinisecrete nila, it further promotes aggregation pa. Okay, so this is the initial rapid and short-lived response to vessel damage. So if we're gonna compare primary and secondary hemostasis, so again, primary hemostasis, it is activated by desquamation and small injuries to blood vessels. Okay, small injuries. So it involves the vascular intima or our blood vessels and our platelets. So this one is rapid. Rapid kasi siya yung unang nagre-respond. Okay? Short-lived because it is just a temporary fix. Okay? Okay, then procoagulant substances exposed or released by damage or activated in endothelial cells, which will further activate naman our secondary hemostasis. Okay? Okay. So secondary hemostasis is activated by large injuries to blood vessels and surrounding tissue. It involves the platelets and coagulation system. Also, yung platelets involved din sa secondary hemostasis because the platelet, again, they secrete their granule content once na na-activate sila. Okay? So, within those granules, okay, meron doong something na nagpo-promote sa coagulation system. Mamaya babanggitin natin yun. Okay? So, it is delayed kasi siya na yung pangalawa na nagre-respond. Long term because ito na yung medyo permanent fix na katawan. So, medyo permanent lang kasi yung platelet plug or yung ating blood clot, hindi naman yan permanent na nandyan na talaga. So, Madidissolve at madidissolve din talaga yan once the damage has been healed. Okay, kaya medyo permanent lang yung term ko. Okay, and then the activator tissue factor is exposed on cell membranes. Okay, so yun yung how would you differentiate primary hemostasis and secondary hemostasis? So, what is the role of the vascular intima in hemostasis? So, vascular intima or the tunica intima is the innermost layer of our blood vessels. Again, on review, we have three layers ng blood vessels. You have your tunica intima, your tunica media, and your tunica adventitia. So, tunica intima is the innermost. Okay? So, this vascular intima, it provides the interface between circulating blood and the body tissues. Okay? So it is composed of a layer of endothelial cells. So endothelial cells, they form a smooth, unbroken surface that eases the fluid passage of blood. Okay? So made up of endothelial cells. Sorry. So we have yung ating tunica intima, it has both anticoagulant properties and also procoagulant properties. So, anticoagulant meaning it prevents clotting. Pag sinabi namang procoagulant, it promotes clotting. Okay? So, yun. Let's discuss further first yung ating anticoagulant properties. First, you have your endothelial cells. Again, the endothelial cells, it provides a smooth inner surface of the blood vessels. It forms a barrier between the procoagulant proteins and platelets in the blood from collagen and fibroblasts in tissues. Okay, it forms a barrier, okay, between the collagen and outer tissues. Okay, so exposure to collagen, okay, pag ang ating coagulation factors, they are freely, coagulation factors natin, they are freely floating in our blood or in our plasma. Once they are exposed to collagen or fibroblasts, na-activate yung ating pathways, coagulation pathways, which will cause clotting. Okay? Kaya ang role ni endothelial cell is form ng barrier para hindi magkatagpo yung ating coagulation factors and our collagen and fibroblasts. Okay. Prostacyclin. We also have prostacyclin sa ating involved as an anticoagulant property of vascular intima. So it is also known as prostaglandin I2. So this one, it can cause platelet inhibition and vasodilator to prevent unnecessary platelet activation in intact vessels. So vasodilator, okay, vasodilate, okay, na lumuluwag yung blood vessels. Okay? So pag maluwag si blood vessels, freely flowing ang ating blood, freely flowing si platelets. Okay, so less chance na ma-activate sila kasi hindi sila magbubungguan basta-basta. Whereas compared mo kapag vasoconstricted, pag constricted ang blood vessels, so mas manipis sila or mas makitid yung daan, mas malaki yung chance na magbungguan yung ating mga platelets sa isa't isa. Pag nagbungguan sila, pwedeng ma-activate and then mag-aggregate which will form a blood clot. Okay? So, next we have nitric oxide. Nitric oxide, this one naman induces smooth muscle relaxation and vasodilation then, almost same with prostacyclin. It also inhibits platelet activation and promotes angiogenesis and healthy arterioles. We have tissue factor pathway inhibitor. This one controls the activation of the tissue factor pathway or the extrinsic coagulation pathway. So this one, may encounter din ulit natin ito sa secondary hemostasis. We have next the thrombomodulin. So thrombomodulin inhibits thrombin through the endothelial protein C receptor and heparin sulfate. So the EPCR binds the protein C, and thrombomodulin will activate the protein C pathway activation. So the protein C pathway stops the coagulation by digesting activated factors 5 and 8, thus inhibiting thrombin formation. Okay? So kapag nawala si factor 5 and factor 8, hindi na mag-move on into the common pathway, yung coagulation pathway natin, hindi ka na makakabuo ng iyong final product supposedly, which is a stable fibrin clot. Okay? So, ayun. So, heparin sulfate also enhances the activity of anti-thrombin. So, how about the procoagulant properties naman? Procoagulant properties of damaged vascular intima. So, procoagulant meaning promotes clotting. Okay, number one, vasoconstriction. Again, kapag nag-constrict si blood vessels, mas kikitid yung daan, mas malaki yung possibility na mag-activate si platelet. We have number two, subendothelial connective tissues. So, these tissues are rich in collagen that binds and activates platelets. So again, collagen can activate the coagulation pathway. Okay? So once damage ang ating blood vessels, may expose si subendothelial connective tissue. So may expose yung blood sa collagen, which will activate the coagulation pathway. Okay? And then also activates platelets. We have 3, von Willebrand factor. So this is a large glycoprotein that is necessary for platelet to adhere to the exposed subendothelial collagen. Okay. So this one is secreted by endothelial cells from storage sites called the Weibel pallid bodies. So the von Willebrand factor acts as the glue, okay, para dumikit si platelet kay subendothelial collagen. We have the P-selectin. So it is an adhesion molecule that promotes platelet and leukocyte binding. And then we also have tissue factors. So due to injury, the tissue factor from the subendothelial smooth muscle cells and fibroblasts are exposed, leading to deactivation of the coagulation system. Okay? So the tissue factor comes from our subendothelial smooth muscle cells. This tissue factor, or also known as factor 3, so factor 3 is the start or is needed para ma-activate si extrinsic pathway. Okay, extrinsic pathway na part ng coagulation system natin. Okay? So once na-expose si tissue factor, magsa-start yung coagulation natin. Coagulation process. Okay? So promotes clotting. Okay. So what is the role naman ng platelet natin in hemostasis? So number 1, platelet adhesion. Okay. So the platelets bind to non-platelet surfaces such as the endothelial collagen. Okay. Non-platelet surfaces, kunyari sa damaged blood vessel, sa blood vessel mismo, dun dumidikit yung platelet. It is called platelet adhesion. Okay. Again, the von Willebrand factor links the platelets to the collagen. So parang yung von Willebrand ay glue. Okay. Para siyang glue, kaya dumidikit si platelet kay collagen. Okay. So the von Willebrand factor binds the platelets through the GP1B95 membrane receptor. So take note of this one. Second, we have platelet aggregation naman, aggregation. So this is an irreversible property by which the platelets bind to one another. Okay? So sa isa't isa na nagdidikit yung platelets, tinatawag na natin siyang aggregation. Okay? So the change in the GPU2B3A receptors allows binding of fibrinogen. Okay? So the fibrinogen binds to the GP2B3A receptors on adjacent platelets and joins them together in the presence of ionized calcium. Okay? Okay. So si fibrinogen, kaya nabanggit dito si fibrinogen, di ba? yung von Willebrand factor serves as the glue para dumikit si platelet sa collagen. Okay? Okay? Tapos, pag, sa platelet adhesion yun. Okay? So, yun yung parang kaparehas niya sa aggregation, si fibrinogen. So, si platelets, once nagdikit-dikit na sila sa isa't isa, okay, so dikit-dikit, hindi yun stable. Okay? Hindi stable yung pagkakadikit-dikit nila, mabilis lang yun matanggal. Okay? Diyan papasok si fibrinogen. Okay? Or the fibrin clot. Okay? Kapag na-activate na si secondary hemostasis, tapos na si coagulation cascade, ang final result nun is the fibrin. Final result nun is si fibrinogen will turn into fibrin. Yung fibrin ngayon, yun yung parang glue naman for the platelets to bind together para maging permanent yung pagkakadikit-dikit ng mga platelets. Okay? Yun yung fibrin. Okay? So, we will further discuss the coagulation cascade pag nasa secondary hemostasis na tayo. Okay? Next, we have platelet secretion. Okay? So, platelets, once they are activated, they secrete procoagulant factors such as factor 5, the von Willebrand factor, factor 8, and fibrinogen. So, as well as control proteins, ionized calcium, ADP, and other hemostatic molecules. Okay? So, once activated na si platelet, they secrete this atong mga procoagulants na to, okay, which will then turn into which will hasten the process of forming our fibrin clot, okay, or our stable na platelet plug. Okay. Okay. So we're done with the summary ng primary hemostasis. So let's move on with the test methods or laboratory procedures. Okay? So most of this you've already encountered na sa inyong face-to-face from last time. Okay? And then meron na ring video discussions naman si Sir Rafi dito ay yung sa bleeding time, sa clotting time, and sa capillary fragility test. So hindi ko na siya further i-discuss pa since you have your lab manuals na rin naman and na-experience nyo na sa F2F. So, papasadahan niya lang natin siya in here. Okay? So, first we have bleeding time, okay, as a laboratory test for primary hemostasis. So, this one, again, is an in vivo measurement of platelet adhesion and aggregation on locally injured vascular subendothelium. So, this one provides an estimate of integrity of the platelet plug. Okay, so ang mini-measure natin sa bleeding time is how fast would your body take before you can form a platelet plug. Okay? Okay, so you have your copy naman na nito sa inyong lab manual. Okay, and your procedure, you have your copy na. So, emphasize ko lang si normal values. So, normal values from our reference, I think this is Rodax to, I believe. 2 to 4 minutes. But on other references, iba din yung makikita ninyo. Okay, so yung mga references sinasabi nila from 3 to 6, basta iba-iba. Okay, so gusto ko lang i-emphasize here and for the normal values, kapag less than 2 minutes, for example, less than 2 minutes, nag-stop na agad yung bleeding, it doesn't necessarily mean na abnormal si patient. So, we have other factors to look at. So, ito yung sources of error na pwede nating makita when we're doing the bleeding time test. Number 1, probably or pwede na masyadong mababaw yung pagkakatusok mo kay patient. Supposedly, 3 to 4 millimeter deep yung pagkakapuncture. But, syempre, tao lang tayo. Not all the time masusunod natin yun. Okay, so, kapag masyadong mababaw yung pagkakapuncture mo kay patient, mas mabilis talaga syempre makaka-form or magsa-stop yung bleeding. Okay? So, kapag less than the reference range yung resulta ni patient mo, it doesn't necessarily mean agad na something is wrong with our patient. Okay? Pwede kasi na ganun lang. Masyadong mababaw lang yung tusok mo. Number 2, pwedeng masyadong makapal lang talaga yung kalyo ni patient sa kamay. Okay? Kaya hindi siya masyadong nagbi-bleed. Pwede rin ganon. Okay? Ayun. So, those are some of the reasons or na kung bakit the bleeding time, actually pati yung clotting time, is near na siya obsolete. Okay? Kasi masyadong maraming factors, hindi siya masyadong standardized, kumbaga. Kasi maraming pwedeng factors na magiging source of error. Okay? Kaya near obsolete na po itong mga lab procedures na to. But still, meron pa rin po kasing nagre-request ng mga doktor and still pina-practice pa rin siya sa lab. Kaya part pa rin siya ng discussion natin. And also, syempre, even though meron na tayong mga mas makabago or mas modern procedures, sa basic pa rin tayo bumabalik. Okay? For us to further understand yung procedure and yung theoretical principle behind. Okay? Yun. Okay? So, yun lang. Ayun. Okay, so let's move on. Okay, IV method for bleeding time. So, may copy na rin naman kayo nito and nagawa nyo na to. So, hindi ko na siya i-discuss pa. Okay. Yan, for example, this one, 1 to 7 minutes yung abnormal values. Pero, syempre, na-experience nyo naman na merong mga patient na hindi talaga nagbe-bleed sa ganitong method. So, less than 1 minute pa yung ibang reading ninyo. Okay? So, it doesn't necessarily mean na something is wrong with our patient. Okay? So, template bleeding time. Okay? So, this one is a type of bleeding time then. So, uses a template containing standardized slit in place of disposable lancets. So, your template has been replaced by several commercially made devices. We have, for example, Simplate and Surgicut. Okay? So, brand itong dalawang to. So, for the template bleeding time lang siya pero modified. Okay? So, parang specialized na gamit na yung ginagamit. Okay? So, the theo behind or the procedure is almost the same lang din naman with our Duke method. Next, we have platelet aggregometry. Okay? So, aggregating agents added to stirred suspension of platelet-rich plasma promotes a shape of change and aggregation of platelets. So, as the aggregates form, the turbidity of the PRP decreases. So, light transmission is then measured and recorded. Okay, so, platelet aggregometry, okay, as the name implies now, we are testing for the aggregation of platelets. So, for this method, we use a spectrophotometer. Okay? So, light transmission ang ginagamit natin to measure the aggregates. We have Rumpel-Leeds capillary fragility test or the tourniquet test, yung ginawa nyo rin sa F2F. This one is a positive pressure technique involving partial occlusion of the circulation of an extremity that utilizes a blood pressure cuff. So, increase in intracapillary hemostatic pressure produces petechiae distal to the point of occlusion in patients with certain diseases. Okay? Kung hindi ka na nilagay yung procedure, may copy naman na kayo and also yung reference range. Pakitignan na lang po sa lab manual. Okay? So, capillary fragility test, as the name implies, it tests for your for the integrity ng capillary ninyo. Okay? So, ano ba yung cases na positive yung result nito? Or, for example, madaming petechiae kay patient. So, ano bang meaning nun? Number 1, again, this is under primary hemostasis. So, we are looking at platelets and blood vessels. Okay? Number 1 possible cause is mababa kasi yung platelet count. Okay, pag mababa yung platelet count, of course, hindi masyadong magpa-function yung or hindi, kung mababa yung platelet count, of course, hindi masyadong magpa-function yung primary hemostasis part of your coagulation, of your coagulation. Okay? So, possible yon na mababa kasi yung platelet count niya, or kaya naman, enough nga yung platelet count niya, hindi naman siya nagpa-function. Parang for display lang si patient. Okay? Nandiyan nga si platelet, hindi naman siya gumagana ng ayos. Okay? So, thrombocytopenia or thrombocytopathia. Those are two possible causes. So, we also have, pwede din natin tingnan yung sa blood vessel mismo. May problema ba siya sa blood vessels? For example, vitamin C deficiency. Okay, so vitamin C deficiency can cause weakness in your okay, how would I phrase this? Kapag vitamin C deficient, so vitamin C helps in the production of collagen. Okay, so if you are deficient in vitamin C, okay, so yung collagen mo hindi maganda yung production. So collagen is needed for the integrity of your blood vessel. Okay? So if you are kulang ka sa vitamin C, it affects din yung function ng inyong blood vessels. So something like that. Okay? So those are the cases kung kailan ka makakakuha ng positive result kay capillary fragility test. Okay? Meron pang iba pero yun yung gusto ko i-emphasize. Lastly, I think, last na to, so we have clot retraction time. So, as time goes by, the clot formed retracts. So, kaya, di ba sinabi nga natin, ang hemostasis is a balance between clot forming and clot dissolving. Okay? So, naturally, nagde-dissolve talaga yung clots na na-form in our body. Okay? So, the degree of clot retraction is measured and the amount of expressed serum. So, clot retraction time, this one naman is, we test how long before a blood clot dissolves. Okay? So, this test is dependent upon the ADP, the level of functioning platelets, and level of fibrinogen and calcium within your sample. Okay? So, you will need test tubes, castor oil, timer, cork, and glass rod. So you have different methods. Number one, we have the castor oil method or the Here's Bowick method. So this one, place a few drops of castor oil into a clean test tube and then place 1 drop of fresh blood without anticoagulant. Without anticoagulant, ibig sabihin, red top. Okay? Or kaya sa plain tube lang siya ilalagay. Pero fresh blood. Okay? Fresh blood meaning dapat hindi pa siya clotted. Okay? Pagkakuha ng sample, start your procedure agad-agad hanggat hindi pa siya clotted. Once clotted na si sample, hindi nyo na magagawa ng procedure na ayos. Kasi kailangan natin is fresh blood. Okay, so place 1 drop of blood into the castor oil and then start your timer. Okay. And then observe for extrusion of droplet-like serum or yung dimpling nating tinatawag on top portion of the drop of blood. Okay, stop your timer as soon as the dimpling of serum is detected. So normal value natin dito is 15 to 45 minutes. Okay. Another method we can use is the McFarlane method. Okay, so for this method naman, place 5 ml of fresh venous blood into a clean, calibrated tube. Okay, insert a glass rod into the tube with the expansion immersed in the column of blood. So fit the cork into the glass rod by boring a hole at the center of the cork and allowing the projecting tip of the glass rod pass through the hole. So this will cover the tube. Okay? So again, sa tube, lagyan ng blood, lagyan ng steering rod, and then tatakpan natin using a cork. Okay? So place the tube in 37 degrees Celsius water bath and absorb every 5 to 10 minutes for coagulation. So 1 hour after firm clotting, so allow the tube to stand at room temperature for retraction to occur. So retraction has taken place if the clot has shrunk and has attached itself onto the glass rod. So after retraction has taken place, remove your cork, remove the glass rod, and attach clot. So measure the amount of expressed serum directly against the calibration of the tube. So, gumagamit tayo ng computation here. So, amount of serum left in the tube and amount of blood used. Okay, di ba naglagay kayo ng, ilan nga yun? 5 ml. So, naglagay kayo ng 5 ml na blood. Okay? So, measure amount of serum left in the tube. Okay, pagkatanggal nyo ng glass rod and ng glass rod, may iwan na serum doon. Yun yung mini-measure. Okay? So, kung ilan yung natira, divided by ilan yung ginamit nyo, times 100, yun yung makukuha yung percent clot retraction. Okay? So, normal value natin dito is around 44 to 67%. Okay. So, that's it for our lesson for week 6 and 7. Okay? So, if you have any questions or for clarifications, you can message me po or your respective instructors na lang. Okay? So, yun lang. So, thank you po for listening.